Welcome, everybody. We'll get started here shortly. Come on in, find a seat. I'll just wait a few more seconds. I've got some people rolling in. I was a little late to open the door here today, so we'll just give it a few more seconds. All right, that's sort of stabilizing. My name is Alan Barr. Welcome to today's webinar. I'm sitting in for Jessica and Michelle today, in case you're thinking you're in the wrong spot, but you're in the right place, as you can see by the splash screen. And on behalf of the Center for Occupational and Environmental Health, I would like to welcome you to the webinar, Quantifying Occupational Heat Stress Among U.S. Agricultural Workers. Thanks very much for joining us today. As a reminder, all participants who log in with their registration email will receive a link to the recording and an evaluation form that will qualify participants for a certificate of completion worth 1 CE contact hour. Just a couple of upcoming webinars to mention. November 3rd, Health Effects of Cell Phone and Cell Tower Radiation, Implications for 5G. This is in partnership with Joel Moskowitz, PhD, and the Center for Family and Community Health. And then on November 9th, we'll have Elevator Ventilation and SARS-CoV-2 Particulate Matter Removal in partnership with Michael Cato and the Center for Occupational and Environmental Health, NorCal ERC. You can register for these and other upcoming webinars at coeh.berkeley.edu/webinars. For today's webinar, you'll be muted during the presentation, but if you'd like to ask a question, please enter it into the online Q&A, and I do encourage you to do so. And we will save time at the end of the presentation to address your questions, or at least as many as we can get to. Today's webinar will be recorded and made available along with past webinars on the COEH Northern California YouTube channel. And I would ask that you please like and subscribe to help us continue to grow our channel. There's lots of good content there. For today's webinar, Quantifying Occupational Heat Stress Among U.S. Agricultural Workers, in partnership with Johns Hopkins ERC for Occupational Safety and Health, we have Emma Moynihan, MPH. Emma is a third-year PhD candidate at Johns Hopkins University, Bloomberg School of Public Health, focusing on exposure assessment and environmental epidemiology. Her dissertation explores the relationships between pesticide exposure, heat stress, and chronic kidney disease among agricultural workers in the United States. Her other active research areas of interest include food system resilience, applied epidemiology, air pollution, and climate change. And prior to her graduate studies, Emma received a Fulbright scholarship to Malaysia. She's worked as a research coordinator at the Johns Hopkins University of Medicine and as a consultant for ICF, where she focused on disease surveillance programs and health surveys for the CDC, NIH, and state health agencies. With that, it's my pleasure to hand the mic over to our speaker today, Emma Moynihan. Emma, I hand it over to you.
Thank you so much for that introduction, Alan. Good afternoon, everyone. I'm happy to be here today to talk about heat stress in occupational settings and about some of my dissertation work that looks at heat stress among pesticide applicators in the United States. As was mentioned, I'm a PhD student at Johns Hopkins, and my advisor is Gurumurthy Ramachandra. I want to begin this talk by acknowledging the people and the funding sources that have made this research possible. Here's an outline of today's talk, starting with how am I defining heat stress? And given this definition, why should we be concerned about it? And then I'm going to go into some broad strokes of what we know about heat stress and occupational health, such as who is most at risk, and what happens to the body under heat stress in occupational settings. And one thing I hope you'll take away from my talk today is that measuring heat stress is a challenge, especially in occupational settings. So I'll go through some of the tools we currently have to measure heat stress and some of the advantages and disadvantages of each. Finally, I'll show an application of using satellite data to estimate heat stress retrospectively in a large cohort study. And this is part of my dissertation work. And then finally, I'll share some concluding thoughts I have, and then, as Alan mentioned, open it up for any questions you might have. So to start, nearly half of all US jobs in the US require some amount of outdoor work. And workers that are have to work outdoors are at the highest risk of experiencing heat stress. Some of these workers that are particularly high risk include agricultural workers, emergency responders, and you can see the list here. The graphic on the right, I really like. This comes from OSHA. So it's heat-related deaths and extreme heat projections for 2020. And there are just a couple of things I'd like to point out here. So the first is that the choropleth map, where we see ranging from yellow to dark red, that in areas like Texas and the Gulf and areas of California, the projection is that up to or even greater than half of the days of the year in these areas might exceed 90 degrees Fahrenheit. And the other thing I want to note is that these green dots are places where heat-related fatalities occurred roughly over the last decade or so. And what I want to point out here is that there are places where, like in the Gulf region and California, where there are a number of extreme heat days, but you also see these fatalities occurring in places where there aren't as many extreme heat days, such as the Midwest and New England. So there are a lot of terms being thrown around in this presentation and just in general related to heat and heat stress in the workplace. And before we dive in deep, I want to make sure we all have a general understanding of the difference between these terms. So this slide is more for reference. I'm not going to read it to you, but one thing I'd like you to appreciate is that when we say a temperature, say 90 degrees, that doesn't automatically equal heat stress. And the second thing I'd like you to know is that there's a wide spectrum of what heat stress can look like physiologically. So to my first point, heat stress is a combination of weather, such as temperature and relative humidity, but it takes into consideration the physical exertion that someone is undergoing. So for instance, if you're sitting at the beach and it's 85 degrees out, that's going to be less taxing on the body than if you're trying to run a marathon in 85-degree weather, for instance. And so the second point I want to make is that heat stress can manifest physically from more minor illnesses such as heat strain to real medical emergencies like a heat stroke. So still on the what do I mean by heat stress part of this introduction. Well, what I mean by it really can vary person to person. Everyone's reaction to heat stress can come down to their unique risk factors and physiology. So basically, the human body works really hard to maintain a temperature around 98.6 degrees Fahrenheit, give and take, in a process known as thermoregulation. And a series of feedback loops in the body either work to dissipate heat when we get too warm or preserve heat when we're too cold. So when we get too hot, we sweat. When we get too cold, the body constricts and we shiver to generate heat. There are limits, though, to the human body's ability to do that in the face of extremes. And those limits can certainly be modified by some of these risk factors that are in this graphic from NIOSH that I really like. So some of these risk factors may seem obvious. For instance, high temperature and humidity, or direct sun exposure, advanced age. But one risk factor that I just want you to appreciate here, that's particularly important in occupational health, is lack of recent exposure. And that's because the body needs time to acclimate to its surroundings and become tolerant to harsher weather. And why I mentioned this is so important for occupational health and when we think about heat stress is when you think about the first few days on the job or the first few days of a heat wave, those are the most dangerous for workers. And in fact, more than 50% of heat-related fatalities occur within the first few days of working in a hot environment. So getting into now, why should we care about heat stress and occupational health? So first of all, I chose this image on the left because I think, certainly this is the case for me, I tend to think of heat stress being an outdoor only exposure, but that's not the case. And there are many occupations where indoor workers are also exposed. So for instance, in this kitchen, potentially. So another couple of points that I want to make about why this is something we should care about is between 2014 and 2016, there are almost 80 confirmed fatalities directly related to environmental heat that were reported to OSHA. The important thing to remember, though, too, is that the number of illnesses and injuries related to heat stress in the workplace is likely much higher than this, and it's just hard to capture the amount of that information. NIOSH does estimate that up to 10 million workers are exposed to high temperatures at work, though that do put them at serious risk for medical conditions. And another thing I'd like you to appreciate about heat stress in occupational settings is that it can be complicated by some protections that we put in place for workers. So for instance, when working with pesticides, you might be wearing certain PPE or protecting yourself from the sun, certain layers, but that can actually exacerbate heat stress. So there are a lot of forces at work here. So continuing on this, why do we care strain? Well, it's a significant public health burden, and it's likely going to get worse. While I think things like fires and hurricanes get a lot of media attention, and rightfully so, it's actually heat stress that causes more deaths per year than any other climate-related exposure. And we have a high degree of confidence, thanks to years of research, that we can expect more deaths related to heat stress by the end of the 21st century. In fact, just by the mid-21st century, the number of days that exceed 100 degrees Fahrenheit may triple compared to the last 30 years of the 20th century. And this image on the right I have here, this comes from the Pacific Northwest heat wave this past summer. And the second line that I want to really draw attention to is this workplace fatality due to heat. And this occurred actually in a 38-year-old farm worker. So someone who's quite young. And speaking of, again, this significant public health burden that heat stress brings, I want to just briefly mention what worker protections are available. And at the federal level, right now, there aren't many government protections available beyond the general duty clause. Furthermore, there was a court ruling just last year that said the National Weather Service's heat index, which I've included a photo of on the right of this slide, actually can't be used by OSHA to determine heat-related illness and injury right now. But even without that ruling, because there's not a federal standard in place to protect workers, that means roughly 130 million workers in the US lack specific protection against hot environments. There are just a few handful of states, such as California, Maryland, that have established some sort of heat protection for workers specifically. Perhaps some good news for heat stress and occupational health is coming. So just a couple weeks ago, actually, the Biden administration announced some efforts and plans to address extreme heat, both in occupational and non-occupational settings. And for occupational settings, specifically, the Biden administration has charged OSHA with developing a heat standard for the workplace. And it also is beginning a new enforcement initiative that will allow OSHA to focus on interventions and inspections related to heat-related illnesses when the heat index surpasses 80 degrees Fahrenheit. So that's my overview. And as we're going into the next part of this presentation, some key points I'd like you to remember are: one, that heat stress is a considerable public health burden. There are a number of terms that can be used to describe the harmful effects of heat on the human body. We can anticipate the number of heat-related illnesses, injuries, and deaths to increase over this century. And currently there's a dearth of heat workplace protections, but potentially that might be changing in the coming years. So now that we have an understanding of what heat stress is and why it's a significant public health burden, I want to talk about ways in which we can measure it. And it turns out measuring heat stress isn't as straightforward as you might assume. So first, there's no real official measure for heat stress. In fact, there are estimated that there are more than 100 different measures that have been used in research and for industrial hygiene purposes. And ultimately, the decision of which metric you decide to use will depend on what your needs are, what data are available, and the climate. For instance, some metrics are better suited in shade, and some metrics are better suited in direct sunlight. So measuring heat stress, how and with what? There are many metrics available, as I mentioned, and I've bolded what I'm going to talk about today. One is the wet bulb globe temperature, which is often considered a gold standard in occupational health. And then I'm also going to be talking about the heat index, because both of these factor into the dissertation research I'm going to be sharing. I've listed some additional popular metrics as well. And then in addition to the metrics that can be used, there are a multitude of ways in which you can measure heat stress or measure these metrics. So there's personal monitoring, area monitoring, and remote sensing, and as well as in some additional ways. But I'm going to be talking about the three that I bolded here: personal, area, and remote sensing. So first, the heat index. If you're familiar with any measure of heat stress, it's likely that you're familiar with the heat index. This is what the National Weather Service says the temperature, described as what the temperature feels like. So it's a combination of the temperature as well as relative humidity. And it actually comes from an older metric that was a bit more complicated. And this actually in and of itself, as you can see in this graphic, is actually fairly complicated depending on the input. So if the temperature is less than 40 degrees Fahrenheit, actually the heat index just is the temperature. But when it's greater than that, then you have to factor in relative humidity. And one thing to note with the heat index is that it is generally better suited for shady areas. Now, the wet bulb globe temperature, this was the metric that was developed by the US military in the 1950s, and we tend to consider it the gold standard in occupational health. And it best estimates the temperature in direct sunlight. And if you have the inputs actually for the wet bulb globe temperature, there's an estimated wet bulb globe temperature calculator you can use on OSHA's website. The wet bulb globe temperature has a number of variables. So in addition to air temperature and relative humidity, which is used by the heat index, it also looks at variables like wind speed, sun angle, and cloud cover. And just for your reference, I've included the formula here. And the wet bulb globe temperature takes two different types of temperatures. One that is able to take into consideration radiant heat, the globe thermometer temperature, and then the wet bulb, which is like if you're putting a damp cloth over the thermometer itself. So one thing I want to point out about the wet bulb globe temperature is that some of these variables are more challenging to collect than others. So for instance, solar radiation and sun angle aren't always easily accessible meteorological variables, not just get with standard weather data. And in some cases, researchers have developed equations and metrics that approximate the wet bulb globe temperature. And I'm just including an image here of one of those highly cited papers that did that. So I've talked about sort of these two metrics that are often used. I want to talk a little bit about how we can measure them and what our options are. And these certainly, what I'm talking about here, this isn't the only ways in which we can measure these metrics. There's certainly more, but I think they're fairly common ways. So one is personal monitoring, or wearing instruments like a smartwatch to measure wet bulb globe temperature or heat index, temperature, relative humidity. And I've included here just some small instruments, examples of these instruments that workers can essentially just wear while they're doing their job. So on the left-hand side, this is a smartwatch developed for like a research study. that can looks at your temperature, humidity, and estimates wind speed. And then there's a where you can say whether you're comfortable or not. And it can also take like heart rate, for instance. And then on the right, the Kestrel heat stress tracker and weather meter is also something that's been used quite frequently in research to estimate wet bulb globe temperature. And just practically speaking, one thing to keep in mind with this is that these can collect a lot of data. So if you're a researcher or you're an industrial hygienist and you're thinking about using one of these, consider how much data that is and how you'll be able to, how you want to summarize it, especially if this is being collected in real time over multiple workers for multiple days. So it's a plethora of data, which can be a blessing, but it can also sort of be challenging in some ways. So in contrast to personal monitoring, another way that we can measure heat stress is through area monitoring. And so this is using instruments that take in the ambient surroundings of a worker or a group of workers. And I've included an image of one such instrument here. And just one downside to area monitoring is that you're not having that same precision that you have with the personal monitoring because a worker is not wearing it. So you might have some differencing in exposure. This is sort of more aerial, even more monitoring. But another option is to gather data from weather stations. And actually, a lot of this data is publicly available. So the National Oceanic and Atmospheric Administration, for instance, provides climatological data going back several decades. And there's also the National Weather Service provides real-time data. And this image I have on the right, this is just comes from NOAA's website. I just picked a random weather station. This is the Maryland Science Center. I'm based in Maryland. And you can see here that you can download their climate data from 1999 to up to this one summer ago. And so finally, I want to talk about remote sensing. And this is what I am using in my dissertation. And it's kind of just a fancy way of saying using satellite imagery or aircraft images of the planet's surface. And so it's really they're sensing the Earth. So it works by detecting the energy that's reflected from the Earth to take photos of physical characteristics of the Earth. And this isn't a new technology. In fact, it's been around for about almost 50 years now, and the data on it are publicly available. And just sort of one tidbit of information is that the Landsat satellite program is probably one of the most well-known from NASA. And actually its 9th iteration just launched a couple weeks ago, the Landsat 9. So this is continuing work that NASA does to get a lot of photos of the physical characteristics of the Earth. I really like this reference document that compares wet bulb globe temperature recommended exposure limits across various agencies and departments. So just thinking about these different metrics for heat stress and the different ways we can measure it, what do we do with those measurements? So coming to sort of these recommended exposure limits. So one thing I like about it, in addition to having multiple agencies or departments, is it also by degree of workload, ranging from resting to a very heavy workload. And so what you can see here is that depending on how much physical exertion the job is, the exposure limit changes. So when resting, it can be as high as 90, 91 degrees, where very heavy as low as 73.4 degrees. And I've just circled moderate here for a number of reasons, but one is, I think this idea of 80 degrees Fahrenheit, going back to the Biden administration's proposed rule for enforcement, and the idea that a lot of work it may be considered moderate. I just highlighted that as sort of a limit to talk about and work with. And one other really important note from this, and if you notice in the title, it's comparison of wet bulb globe temperature exposure limits for acclimatized workers. So going back if you remember to that graphic I showed earlier, where all the risk factors for occupational heat-related illness and injury, that lack of recent exposure was a big risk factor. And here too, it's saying that if you're new to the job, you're not used to working in these conditions, then this isn't necessarily relevant for you. And in fact, that we might need to think about an even more stringent level of protection for those first couple of days on the job, or the first couple of days in which the weather is just really, really warm and you're not used to it. Even more so than just general workplace protections. So in closings, there are a plethora of metrics to measure heat stress. And I talked about just two of them, the wet bulb globe temperature and the heat index. And one thing to consider is that the wet bulb globe temperature, it's often considered the occupational gold standard, but it's not always possible to use it just given the number of inputs that are required, some of which are more accessible than others. And I also want to just mention that there are methods for measuring heat stress can range from personal monitoring to remote sensing to a number of other ones that I didn't really talk about here, like the use of biomarkers, for instance. And depending on what metric you use and then how you're going to capture it, again, all this comes with their own pros and cons, and it really is going to depend on either your research needs or your workplace needs for industrial hygiene purposes. So in this section, I'm going to talk about some of my dissertation work, which looks at heat stress among participants in a large cohort study run by the National Institute of Environmental Health Sciences and the National Cancer Institute. It's called the Agricultural Health Study. And I've been developing methods to estimate their exposure to heat stress. And I want to share some of those methods with you today. But before I dive into those methods, I want to talk about why I'm doing this. And that comes down to something called chronic kidney disease of unknown origin. It's also been called chronic kidney disease of unknown etiology. Some of you in the audience might be familiar with it. But briefly, over the last 20, 30 years or so, there's been an alarming number of advanced cases of kidney disease, particularly in global agricultural worker populations. And what's really alarmed scientists and clinicians is that these cases have appeared without the presence of the traditional risk factors we generally see with kidney disease, which are people of older age or people with comorbidities like diabetes or hypertension. And this, I think, is an interesting perspective piece from the New England Journal of Medicine, where they sort of usher in this idea of a new era of climate medicine. And in fact, they call this CKDU heat-triggered renal disease. So they're positing some hypothesis into what's causing it. And I've quoted them here. And while some risk factors for CKDU do remain enigmatic, what we know for certain is that CKDU is related to heat exposure and dehydration. And I think there's still a lot to tease out here and trying to understand the relationship between heat stress and dehydration and kidney disease. And that's really what my dissertation is trying to look at. And in particular, in the US, a lot of this research has been done in more tropical climates. So the Agricultural Health Study, as I mentioned, this is the cohort study that I'm working with. It is run by the National Institute of Environmental Health Sciences and the National Cancer Institute. And it's a prospective cohort study, which means that they are following people over time from when they agree to be in the study until they leave the study for any number of reasons, such as lack of follow-up, death, end of the study period. So the study has been ongoing for almost 30 years now. It began in 1993, and it's continuing. It's largely survey-based, and so new surveys get sent out every several years to the participants. It's based in North Carolina and Iowa, so two large farming states. As much as the survey-based research, and it asks questions about pesticide use, health history, work practices, so like how frequently you use pesticide, what pesticides you use, what crops you grow, or animals you raise, lifestyle and diet related questions. And just one thing to point out too is the actual information I get on kidney disease of these participants comes from a kidney disease registry, but largely otherwise the information I'm getting comes from this survey here. And I've included a brief table on the right, just for your reference and for things to think about, because I'm going to be sharing some results using this cohort, and I want you to be aware and think about the generalizability of the results. So this cohort is largely male, and it's largely white, and it's somewhat split between Iowa and North Carolina, but slightly more individuals in Iowa than North Carolina, and sort of just thinking about the climate in those two different regions. So when I talk about my methods, I want to preface by saying each of these steps could themselves be an hour-long presentation. So hopefully boiling it down over the next 10 or 15 minutes will work. And now why each step could be an hour-long presentation is in part because heat stress wasn't captured originally in this study. There were some tangential questions about how long someone spends outdoors, but we don't, for instance, have monitoring data going back to each participant's entry into the study. And so to look at that, I need to retrospectively assess it. That is, find data that were collected back when participants were enrolled in the study and that have been continued to be collected into the present day, and use those to estimate their exposure to heat stress. So I'll talk about each step in greater detail, but the very basic steps that I've listed below are, one is I needed to determine what climate variables are needed for assessing heat exposure and at what frequency. So for instance, temperature, relative humidity, do I need wind speed? How often do I need it? Does it need to be daily, hourly, weekly? I need to figure out what databases are available, what data is available for me to run this analysis. I also will need to think about, once that data is available and I've collected it, how do I assign that data to each worker, and what assumptions do we make about what climate they're exposed to? And then I'll need to make sense of all this data that I've collected and how I can summarize it for each worker for the duration of time in their study. And then eventually, the last step is to develop this actual heat stress metric for each worker. Okay, so steps 1 and 2, determining what variables we need and where to get them. Fortunately, the NCI and NIEHS were looking at this data set, the North American Regional Reanalysis, for a number of other research projects. And it turned out that it really well suited what I needed to use for looking at this question. So the North American Regional Reanalysis, it's a daily climatic variables from 1979 all the way to 2018. And a reanalysis essentially is a method that combines both modeling with past weather data. And one thing to note that's quite nice about this is that it's available at fairly granular levels. So at the 32 kilometer or 20-mile grid, data is available both daily and monthly. And there's a number of climate variables that are available, including some of the ones I listed here below. I'm not going to read them out to you. So this was available. And so I needed to make sense of, given this climate data, how do I assign each worker to the weather that they've experienced? And that comes down through a process called geocoding. So all this data, which actually is in probably all the hundreds of gigabytes, is downloaded. And what the process that we went through, that NCI went through with the geocoding process, is we used each worker's address and found the closest point on that reanalysis data that mapped to their address. And so made the assumption that climate data from that site was approximated what they experienced based on their home address. And again, these are about 20-mile grids, so it's fairly granular. We're not making assumptions about people living 50, 100 miles from the site in which the data is collected. Okay, so we figured out what data to collect and where to get it. And I wanted to think about what heat stress metric to use. And while this NAR, this North American reanalysis data set had a number of variables that were really invaluable to calculating heat stress, it didn't have some of the necessary requirements to calculate the wet bulb globe temperature directly, which I really wanted to be able to calculate it because it's considered a gold standard in many ways, in many respects. However, if you recall earlier in my presentation, I talked about the fact that there are some equations that are available to estimate the wet bulb globe temperature that don't use necessarily the same demanding inputs that wet bulb globe temperature does. And so that's what I did. I estimated heat index actually for each worker using just relative humidity and air temperature, which is available in this data set. And then I used an equation that's been developed that can approximate the wet bulb globe temperature using just the heat index in a series of constants. And I've included that formula here just for reference. And one thing I'll add is, if you remember, I mentioned that the heat index tends to be better for shady areas and the wet bulb globe temperature tends to be better for direct sunlight. And so there's an addition here, 3.5 degrees Celsius, to account for that. Okay, so we have the data, it's been geocoded, and we know what metric to use. So the next obstacle I had to think about was that the data I had was immense. So there's over 80,000 participants in the Ag Health study, and the data was available daily for up to 40 years. So I think if you multiply all that out, you reach a couple billion data points at that rate. So not easily digestible. And I needed to figure out a way to make that data analyzable. So the first step I took is, I thought about it and realized, I'm not particularly interested in temperature and relative humidity outside of the warmest month of the year when participants are outside and at the greatest risk. So I decided to only use data from May to September. So that cuts down to more than half of the data points. And then also the beauty in using the heat index is it really only takes 2 inputs. It just takes the relative humidity and temperature. So that also can cut down on some of the inputs. And then I also decided, instead of using daily data, I created, for each worker, for each year they were observed, I used their daily relative humidity and temperature they encountered from May to September, and used those 2 inputs to create an average seasonal heat index for each worker in a given year. And because I didn't necessarily know whether coming up with an average heat index was the right metric to use to really understand this relationship, if there exists one between heat stress and kidney disease, I also used the same methods and came up with a maximum heat index and a 95th percentile heat index for each worker for each year. And I just want to preface that I use 95th percentile. It's a benchmark often used in occupational health used for setting sort of acceptable thresholds. In case anyone's interested in, well, why 95th percentile? That seems like a random percentile. Okay, so hopefully you're still with me. So once I had a measure of heat index, again, average, maximum, and 95th percentile for each worker for each year, I then was able to take that and estimate a wet bulb globe temperature using the equation I showed previously. And then finally, I was able to use that estimated wet bulb globe temperature and put it in a regression model, looking at the association between heat stress measured through the wet bulb globe temperature and kidney disease. And I'm going to be sharing some of those results in the next couple of slides. And just one thing to point out too is, specifically I have here end-stage kidney disease. And that's because this data we have is looking at participants who have the most severe form of kidney disease, which generally requires either dialysis or a transplant to survive. So quite serious medical condition. And so now I'm going to and just a note. I'm still working on my dissertation, so these are very much still work in progress. But I think nevertheless they're interesting, and I'd like to share them with you today. So first, I want to share some summary statistics as well as some trends on the wet bulb globe temperature before we go into the regression analysis, just because I think they're important to recognize and also quite interesting. So I hope these summary statistics make sense. The interpretation's a little bit wordy, so we can go through it one step at a time. So starting, for instance, with the 95th percentile wet bulb globe temperature, you can interpret that to mean across all ag health study participants, the average 95th percentile seasonal wet bulb globe temperature, again, I'm taking from May to September, that participants were exposed to over the entire sort of period that this data was available, was 79.5 degrees Fahrenheit. So just shy of that 80 degree Fahrenheit threshold. And likewise, you can interpret similarly for mean and for maximum wet bulb globe temperature. And in case that interpretation is still a little bit jargony, to break it down more, you can think of it as the overall 95th percentile wet bulb globe temperature among all ag health participants from 1979 to 2018, calculated by taking each worker's seasonal 95th percentile wet bulb globe temperature, was 79.5 degrees Fahrenheit or 26.4 degrees Celsius. And so what are the implications here? Well, there's some extrapolation going on, but generally for the seasonal 95th percentile and maximum wet bulb globe temperature, workers tend to be approaching or exceeding that 80 degree Fahrenheit threshold. And so the question I had is just how often is this happening and is it changing over time? So the answer is quite often, and yes, it does. So the graph I'm showing here shows the percentage of seasonal maximum wet bulb globe temperatures among ag health study participants that exceed 80 degrees Fahrenheit by decade. And so the important information I want you to take away or digest here is that in every decade, the majority of participants have maximum wet bulb globe temperatures that largely exceed the recommended limit of 80 degrees Fahrenheit. And for just that time period in which they were enrolled in the study from the 90s to 2010, that actually increased by 10% from the 1990s to 2010. And just to make sure that we all understand what this graph is saying, I'm not saying that out of every single wet bulb globe temperature measurement, 92% of those exceeded 80 degrees Fahrenheit, but rather of the maximum seasonal wet bulb globe temperatures recorded in the 2010s for each worker, 92% of those exceeded 80 degrees Fahrenheit. Now, this is a similar narrative for the 95th percentile measurements as well, but in fact, it's even more striking. And you can see from the 1990s, the percentage of 95th percentile wet bulb globe temperatures exceeding 80 degrees was only 36.7%, but by the 2010s, that almost doubled to 60%. And here I think is a nice, I've just a nice table that really can summarize that information as well. And I've called out a few specific years. And what I want to draw your attention to is the first year in which we have data available, 1979, in which you can see that only 21% of the 95th percentile and 74% of the wet bulb globe temperature exceeded this 80 degrees Fahrenheit. When you compare that to the hottest year on record, 2012, that's jumped to almost 92% from the 95th percentile and almost 100% of the maximum. And if you compare that to the last year on record, which is quite similar to 2012, you still see this very large increase from just the 1979 to the 2000s. So I think those are some interesting trends. And the last thing I want to share are just some results from this regression looking at the association between heat stress measured through the wet bulb globe temperature and end-stage kidney disease. And so again, this is very preliminary work, but what I've discovered so far is that that using that higher average and 95th percentile wet bulb globe temperatures among participants in the ag health study are significantly and positively associated with developing end-stage kidney disease. And I've reported the hazard ratios here. This is for the average and the 95th percentile. And you can kind of think of a hazard ratio, for those who aren't necessarily familiar, as a measure of risk. And so a value over 1 would be an increased risk, and the p less than 0.01, meaning it's statistically significant here. I will note that the maximum wet bulb globe temperature wasn't significant, at least in this analysis. And so I'm excited to take this forward and iterate on it more and understand what these findings mean. But I wanted to share those with you today. And so before I close, there are just a couple things that key points that I've listed here. And if you're going to take away anything from today's talk, I hope you know some of these facts. So the first thing to note is there really aren't any federal protections to protect workers from heat stress beyond OSHA's general duty clause. And while I've been talking about the wet bulb globe temperature, because it's considered a gold standard for assessing occupational heat stress, it's certainly not the only one. In fact, there are 100+ measures that exist, which can make it sort of challenging to decide which to use. Some metrics are more challenging to use than others, just given the number of climatic variables that are required. I want you to appreciate that the data from remote sensing and satellite imagery and local weather stations can be valuable tools in assessing occupational heat stress. Still, we should be aware of the limitations in doing so, the assumptions that we make. I also want to point out, just from looking at this cohort study, that the participants are certainly being exposed to wet bulb globe temperatures above that 80-degree threshold. And preliminary results suggest that a significant relationship between higher wet bulb globe temperatures and kidney disease among participants. That concludes my talk for today. Thank you so much for the time to talk about this. I'm really passionate about it, and I look forward to any questions that you might have. Thank you so much.
Thank you very much, Emma. That's a fascinating talk. We do have some questions that have come in.
Should I stop sharing, Alan? Or
no, someone may reference a slide, and it's totally fine to just leave that for now. Great. Thank you. I have a question for you just to kick it off. Are you aware of any sort of active protective garments that agricultural workers are wearing in the field? Is there anything like that beyond sort of a passive, long sleeve shirt or something to keep the sun off of you?
Yeah, that's a really great question. I haven't looked into it too much in terms of what particular garments. I do know one thing that that states that have implemented some protections for workers related to heat stress have implemented are very strict requirements for how often workers can get water and go under shade, and so just making sure that is available to them as a way to try to combat some of the heat exposure. But that's a good question about garments.
Okay, thanks. You mentioned that California had some regulations that went beyond the general duty clause, and I was curious if you've been able to see the impacts of those regulations on the numbers in general.
Yeah, it's a fairly recent law, and some of you folks who are California natives might be more familiar with it than I am. I'm not sure too much if there's been any particular research studies that have compared it, but I do know that it's implemented some of these ideas for mandatory water breaks and things like that. But I would certainly be interested in seeing if anyone does look into that. It would be certainly worthwhile.
All right, great. Thank you. Let's jump in here. How many U.S. jobs expose workers to heat stress indoors? Did you look at that?
So the estimate I saw, it was up to 130 million individuals, and that includes both outdoor and indoor workers. I think it's a little hard to disentangle who is solely outdoor and who is solely indoor, because a lot of jobs are both outdoor and indoor. So I think the important thing to recognize is that there are tens of millions of workers that are potentially being exposed to heat stress.
Understood. Thank you. How has COVID and the use of PPE in hospital settings impacted incidents of heat stress?
That's a great question.
I know that's not really your focus, but I'm just curious if you have
Yeah.
the insights there.
I can certainly, we can sort of think it out. I would certainly, with use of PPE in hospitals, which is certainly necessary. It also makes individuals warmer. You would hope that there would be, air conditioning and proper ventilation in hospitals. So hopefully that would mitigate heat stress somewhat. But that's to say, certainly paramedics and things like that, they're certainly working outdoors. So I do think it's an interesting and important nuance to think about. But yeah, it's not something I particularly work with.
Got you. Thank you. Do you have any insights into these? You showed a slide that had some monitors on there that showed heart rate and so forth. And do you know if any of those personal monitors are being used as a PPE or sort of a, reporting stations from workers back to a central location to alert the worker or the supervisor that this person, a particular individual is experiencing or is at risk for heat stress?
I think that would be great. The work I've seen, this has been largely more so in research studies. So I haven't, at least I'm not familiar with this being used on really a wide scale to prevent heat stress.
Gotcha. Someone says that they realize this is about heat stress, but what's the public health burden of cold stress? Is that also covered under the general duty clause?
That's a great question. So I don't know a lot about cold stress. I'm going to certainly look into it after this presentation because now you sparked my curiosity. I would think it would fall under the general duty clause and the idea that protecting workers from harm. I don't know the burden that it causes. I'm not sure what the incidence of hypothermia, for instance, is, but I'll look into it because I'm curious.
Excellent, thank you. Here's one for you. Why would we consider wet bulb as a gold standard? Wouldn't it be better to measure the actual physical effects on workers measured through personal monitoring devices? Wouldn't that be more accurate?
Yeah, that's a very fair point. And so perhaps when I say it's the gold standard, it's sort of the gold standard that we've been using for quite a while when we haven't necessarily had the option of using personal monitoring equipment. So if you recall, the wet bulb globe temperature has actually been around since like the 1950s. So things like smart watches, some of these heat stress trackers haven't necessarily been around quite so long. So the idea to wear a smart watch to take account of someone's heart rate and things like that, in addition to temperature and relative humidity, is quite new. So it's possible that as research changes, as new technologies come into existence, that maybe that standard will change. Certainly, standards don't have to be the same forever.
Yes, and there are a couple more comments regarding that. So it's the idea that heart rate monitoring, for example, via these devices could take into account the physical work demands and the PPE or other environmental factors that go beyond the wet bulb data.
Yeah.
Okay, so
one thing I'll just point out with the watches though too, and heart rate monitors is there's, and just instruments in general, is that there is a wide variability in how well these trackers work. So you sort of want to, when you're thinking about using personal monitoring instruments, you don't want to just make the assumption that they're essentially more accurate because you're wearing them. Like that might be true in many cases, but if it's badly calibrated, or if it's, I've seen studies where they've looked at odometers just being off by thousands of steps. So just something to keep in mind.
Absolutely. I think the idea behind wearables and evaluating or measuring potential occupational hazards is still vanguarding and still coming online. I think it'll only continue to improve as the as the technology catches up with our ideas. Here's one for you. Since increased airflow plays such a large role in reducing the wet bulb temperature, a very major factor in determining the wet bulb global temperature index, is this factor accurately assessed by satellite measurements? How has your interesting formula been validated with field measurements?
Right. So the equation that I'm using to estimate the wet bulb globe temperature, I they validated this equation in order to come up with this estimate. So they were able to take field measurements of the wet bulb globe temperature using different equipment, and then we're able to approximate that and come up with this equation to then estimate wet bulb globe temperature using just the two inputs. So they had that data on wind speed, for instance, already, and they used that to see if they could simplify the formula and still remain fairly accurate.
Excellent, thank you. What assumptions were made about workload and clothing? Don't agricultural workers move around a lot, travel as crops ripen and so forth? What assumptions did you make about protections available to workers like water, rest breaks, and shade?
Right, so that's a great question. And the assumptions that I'm able to make are going to depend a little bit on what is covered in the survey. And so one thing I want to really dive into that I haven't just yet is thinking about the survey does ask questions about PPE use. And so I want to think about how I might be able to quantify that and incorporate that into an equation and think about how that might impact heat stress. It's not something I've done just yet. This is, again, sort of early on in my dissertation, so I'm still working on it, but it's certainly at the forefront of my mind. And I think with the survey questions they ask about PPE, I'll be able to incorporate that into some future iterations of this analysis.
Thank you. And you mentioned something about Maryland's regulations, but one of the attendees has commented that those are not in effect yet.
Right.
Another question is, what can employers do to reduce risk of heat stress for their employees?
That's a great question. So I think some of the one thing would certainly be frequent breaks, certainly in the shade, with adequate access to water for hydration. We know that dehydration is a really serious issue in heat stress. I can't stress enough too how important acclimating to weather is. And so if you are bringing on individuals who are new to the job, or if it's the start of the season, doing so slowly. So I think NIOSH and OSHA, it might be both of them, it might just be one of them. They actually have come up with a recommendation for gradually increasing the amount of time that a worker is exposed to those conditions, so that they are not in a place where they're particularly vulnerable. Again, if you remember earlier on, I mentioned that more than half of a worker fatalities due to heat stress really occur within the first few days of the job or in a hot environment. So I think that's another really important piece. And thank you too for the reminder about Maryland. Yes, I did know that. I had it sort of just lumped in with the other states, but it's an important point.
Yeah, I thought being from Maryland, you might know that. I think you just touched on this, but it's worth mentioning again. Is dehydration something that should be investigated in combination with heat stress? I'm curious. This is in this due to practices across farms. Yes, practices across farms, i.e., employers giving access to water and so forth.
Yeah, I certainly think so. And if we think about kidney disease too, I think you can make sort of the case of why dehydration might be important or involve some way in the pathway between kidney disease and heat stress. And the idea being that the kidneys are so important for filtering waste and for and so I think it's certainly an important facet to think about. And we know that dehydration is so important in determining the extent severity of heat stress. So yes, certainly.
Well, that's great. Thank you. I just time for one more comment here. I apologize to those whose questions I couldn't get to. Dr. Krause points out in answer to my question that on the impacts of California standards, that compared to Florida over a period of time here, I'm just sort of paraphrasing, reduced heat related deaths in California to nearly zero, while Florida incidence remained high. That's just a closing comment that these regulations can have some impact and have been demonstrated here in California. I'll I think if anyone has questions for you, are they able to contact you at the?
Oh yeah. Let me put my email under.
I'll let you throw that up there while I make some closing remarks. You can learn more and register for our upcoming events at coeh.berkeley.edu. You can also subscribe to our YouTube channel, where you can find recordings of previous webinars and other events. As a reminder, all participants who logged in with their registration email today will receive a link to an evaluation form that will qualify participants for a certificate of completion worth 1 CE contact hour. If you have questions for us here at COEH Northern California, you can drop us a line at coehce@berkeley.edu. That's coehce@berkeley.edu. I want to give a big thank you to our presenter and to everyone who joined us today for today's webinar. Emma, do you have any closing comments?
Thank you guys so much. I know everyone has really busy schedules, so I really appreciate taking the time to listen to me speak and hearing my thoughts. And thank you so much, Alan, and to everyone at the ERC who has made this possible.
Excellent presentation, Emma. Thank you so much. We'll see you next time, everybody. Bye-bye.